board certified neuroscientist, psychiatrist, and psychedelic drug proponent, Dr. David Rabin. Dr. Rabin, welcome to the show.
Thank you so much for having me, Dr. Orden.
Really a pleasure. So, when do you turn to psychedelic drug therapy like ketamine in your practice?
Psychedelic is a word that we've often misunderstood as crazy 70s dance party, as you alluded to earlier. But what it actually means is psyche means mind, and delos means to show. And so psychedelic refers to more of a state of mind rather than a specific medicine. Ketamine is very interesting because it's the only currently legal psychedelic medicine to be used in clinical practice in the real world right now. And it's legal in every state and almost every country of the world. And it's been studied for over 70 years. So it's very, very safe medicine. Because of the great safety profile of ketamine and understanding, particularly with low dose ketamine over the years, it's basically a molecule that we can introduce into the therapy program. We're trying to induce these states with people where they feel safe enough, which is absolutely critical, to sort of self-reflect on their past, self-reflect on how they view themselves in the world. And the medicine amplifies that.
How exactly does ketamine work? Why is it such a great key, such a passport to sort of opening up the mind, opening up to relax it and to sort of free it up so we're more comfortable talking about things that may sort of be locked up inside?
We don't completely understand how ketamine works. We know it works in a very complicated system of acting on multiple neurotransmitters in the brain. We know it acts on the NMDA receptor, which is one of the most common receptors in our brains for pretty much everything. We also know it acts via the opioid receptor as a thought to be going down the pain pathway. And when you block the opioid receptor, which some incredible research at Stanford showed, you could actually block the effects of ketamine, which is very interesting. So it seems to act in an opioid receptor dependent manner, but it's not an opioid. And so it doesn't have the same kinds of side effects that opioid medications have. And so but it does act as an anesthetic, meaning a pain reliever in some ways, not just physical pain, but also emotional pain. And when people are in that state and the setting and the experience, the room, the music, the care provider holding safe space for an individual helps them feel safe enough to go into that experience without judgment, then all of a sudden we have the ability and recognize the opportunity to start to reevaluate and reappraise some of the ways that we've been thinking about ourselves. Almost like pressing pause for a brief moment on that tape that is playing in our minds about the way we've been taught to see ourselves over and over and over again. Sometimes that tape is playing for so long we forget that it's even there.
It sounds like you're saying you can almost see yourself in a new light. Knowing everything you know about yourself, you can step outside of that almost and be more objective when it comes to looking at why you're doing the things that you are doing and how you can change your life. Is that an accurate description of what's going on during the process?
I would say that's fair. I think one of the ways I like to describe it is like the Robert Frost poem about two roads diverge in a yellow wood, and I chose to take the road less traveled. If we don't know there is another road to take, then we'll always take the same road over and over and over again because that's what we were taught. And that is what we do because we're creatures of habit. And so we do what we're taught unless we take the time to step out of that pattern and then look and see what else is available to us.